My name is Adam Sutton, and I'm a board-certified dermatologist and fellowship-trained Mohs surgeon. I'm the director of Mohs and dermatologic surgery here at UNMC in Nebraska Medicine. I grew up here in Omaha, Nebraska. I attended University of Southern California for my undergraduate education. After completing my education at USC, I came back to UNMC for my medical school. After my third year of medical school, I went to Emory Gozueta Business School in Atlanta, Georgia for my master's in business administration with a healthcare focus. I returned to UNMC for my final year of medical school and then did additional medical training in Los Angeles. I did my internal medicine year at Cedars-Sinai Hospital and then did my dermatology training at University of Southern California. After USC, I went to San Diego and did a fellowship in Mohs and dermatologic surgery at Scripps Clinic. Dermatology made sense for me when I thought about all of the things that I really liked about medicine. Going through medical school, I went in with an open mind and tried to think about the things that I really wanted to do with my career. I wanted a specialty where I could see patients in both the acute and outpatient setting. I wanted to be able to use medical and surgical treatment modalities for our patient. And I wanted to work in a specialty where we got to treat a broad set of conditions and have high variety in the kind of things that we see. And all of these things drew me to the specialty of dermatology. Academic medicine has always been something that's been of significant interest to me, and having the opportunity to come back to UNMC and Nebraska Medicine is really a tremendous honor. There are a lot of things that I like about academic medicine. The opportunity to work with trainees of all different levels, from medical students to advanced training at the fellow level, to be able to collaborate with specialists and thought leaders in other areas of medicine, and then ultimately to be able to take care of patients in a multidisciplinary and group setting and really care for some of the most challenging cases. I think that these are all things that made me really excited about coming back. Some of the common conditions that I see really fall into three kind of broad categories. The first would be skin cancer. I take care of skin cancer of all different types, from common skin cancers such as basal cell and squamous cell carcinoma to more dangerous skin cancers such as melanoma and rare skin cancers. I care for patients that are high risk for skin cancers, including transplant patients, patients with a history of cancer, and then patients who may be immunocompromised for a number of different reasons, but including from medications that they may be taking. The second category of patients is patients with vein disease. I care for patients with varicose veins and other types of vein disease, and we use medical and surgical treatment modalities to care for patients with symptomatic disease. And then the final category of patients would be laser and cosmetic patients, and we use lasers in dermatology for all types of things, but we use lasers for treating patients that have burn scars that may have contractures from those burn scars, or treating patients that need scars to be rehabilitated. And then we can also use lasers for cosmetic treatments such as full face resurfacing or treating brown or red spots.